We've all seen the news about Johnson & Johnson vaccine. Today's just the third safe, effective vaccine, and it's out. They've approved it today. This could unite us as a country to vaccinate America, to protect America, to heal America. And I know we can do this.
Good news on the vaccine front. The Johnson & Johnson vaccine approved for emergency use. We're joined now by President Biden's chief medical advisor, Dr. Anthony Fauci. Dr. Fauci, thanks for joining us again this morning. Let's talk about this Johnson & Johnson vaccine. The first shipments are expected this week. It's great news to have a third vaccine out there, but as you know, there's a fair amount of skepticism out there as well because the vaccine has a lower effectiveness overall than the Pfizer and Moderna vaccines, about 72 to 95%. What do you say to those who want to wait for the Moderna and Pfizer vaccines?
We've got to get away from that chain of thought, George, for the following reason. The only way you really know the difference between vaccines is by comparing them head to head. We have 3 highly efficacious vaccines that are safe and efficacious. That's the bottom line. And the J&J, if you look at them, particularly in things that we really care about that are important, it's got greater than 85% efficacy after severe disease and critical disease. And there were no deaths or hospitalizations in any of the countries that were tested. And remember, they tested in the United States, in South Africa, and in South America. This is a good vaccine. I think we need to pull away from this comparing and parsing numbers until you compare them head to head. Just be really grateful that we have 3 really efficacious vaccines.
So bottom line, if you're offered a vaccine, whichever one you're offered, you should take it?
Absolutely, George. The most important thing from a public health standpoint is to get as many people vaccinated as quickly and as expeditiously as possible. I can tell you I'm vaccinated now, but if I were not vaccinated and I was going to go into a clinic and they said, hey, we have J&J now, or you can wait 3 weeks or so to get another one, I would take the one that is available to me now, because the quicker you get vaccinated, the more quickly you will be protected and you will add on to the overall protection in your county, in your country. I mean, to me, that is a no-brainer.
We don't know a lot about how the vaccines affect transmission, whether they truly prevent transmission. So for people who have been vaccinated, what can they do? How should they still be careful?
Well, you should still be careful, George, that you could conceivably have, because the end point of the vaccine efficacy trial is preventing symptomatic disease, which means that potentially, theoretically, and maybe in reality, you're going to have infection that you don't get any clinical manifestation. So you could be protected from disease and still have virus. If that's the case, then that's the reason why you hear us all the public health officials saying to wear a mask. And the reason is essentially to protect other people from occasionally, you may inadvertently infect someone else, even though you are protected. That's the reason. Now, when you get 2 people that are vaccinated and protected together, like in a home setting, you could have 2 people that you would not need to do that. We're working with the CDC right now on trying to get updated, reasonable recommendations of what we can tell vaccinated people to do as you get more and more people vaccinated. But the reason we say mask, and sometimes people don't understand that and think it's being too rigid, there will be a time, and I believe it will be reasonably soon, when we will know exactly whether or not a vaccinated person really has such a low level or none at all of virus in their nasopharynx. That will be based on data. We have some preliminary data from some Israeli studies that the level of virus in the nasopharynx of vaccinated people is extremely low. If that's the case, and the future studies show that it's that low, then you'll be pulling back on some of the restrictions. But you want to do it based on data, George, not on guessing.
CDC experts also meeting today to discuss which population groups should receive priority for the vaccines. And we know that the vaccine rates for Latinos and Black Americans are still lagging behind white Americans.
Yeah, that is clear, and that's one of the reasons why what the president is doing, and we are seeing that through the Equity Task Force, is we're getting community vaccine centers that are being put up. We have over 400 of them will be come up, and we're going to designate that they go specifically, several of them, in areas in which demographically you see more minorities. in addition, mobile units that will be going out into the less well-served areas and then get a lot more vaccinators to quickly get it to them. We have an equity task force that's chaired by Dr. Marcella Nunes-Smith, whose virtually only job is to make sure we have equity in the distribution. You're absolutely correct. Since minority populations, particularly brown and black people, clearly have a greater risk of getting infected and a greater risk of serious disease, we've got to get the vaccines to them in an equitable manner.
Dr. Fauci, thanks very much for your time and your information this morning. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.